Good afternoon, everyone, and thank you for joining us. In this year's throne speech, the government of Bermuda set the agenda for a fairer Bermuda for all through various initiatives. And this afternoon, I would like to expand on those initiatives that are impacting our health. And I am pleased to report that we are making steady progress, particularly in fostering a healthy community. It is worth noting again that for the third consecutive year, we have maintained a freeze on the government's portion of the standard health benefit. This is one of our key fairness initiatives, ensuring that health care remains accessible and affordable for everyone. The Ministry of Health is committed to promoting healthy people and healthy communities. And this is not just about individual well-being, it's about taking a comprehensive, collaborative approach to tackle the broader societal and environmental factors that impact our health. This means championing physical fitness, preventing diseases, and nurturing inclusive, safe, and supportive environments that enhance mental and social well-being. We know that from our data, that non-communicable diseases such as heart attacks, strokes, cancers, and dementia are leading causes to death in Bermuda, with diabetes and chronic kidney diseases significantly impacting health as well. And in this year's speech from the throne, it was emphasized that chronic diseases are significantly affecting us, straining our healthcare system, raising costs at all-time levels, and reducing the quality of life that people should be able to enjoy. In order to lower the risk of heart disease, stroke, diabetes, and other conditions, new laws will be passed to remove foods with industrially produced trans fats from our food supply. These fats have been scientifically proven to cause these health problems. The Department of Health has been clearing the way and clearing the path and building capacity to perform local testing and working with our advisors at the Pan American Health Organization and the United Kingdom Health Security Agency. Education and consultation will precede any legislative changes, and once the legal controls of trans fats are adopted as policy, various stakeholders, internal and external, will be convened to familiarize everyone with this issue and their role in reducing the risk of trans fats in our food chains in Bermuda. A high intake of trans fats poses serious health risk, increasing the likelihood of death from any cause by 34%, coronary heart disease deaths by 28%, and coronary heart disease overall by 21%. Despite having no known health benefits, trans fats found in partially hydrogenated oils, or PHOs, are commonly added to foods to extend the shelf life. The food industry values these fats for their ability to add firmness to margarines, provide plasticity, and maintain emulsion stability in shortenings. Yet, these functional benefits come at a steep price to health, with significant risks that far outweigh any convenience that they provide. By July of 2024, 58 countries covering a population of 3.7 billion have implemented top-notch policies to eliminate trans fats. In 2022, CARICOM Ministries of Trade and Health committed to enacting laws by December 2024 to remove trans fats from Caribbean foods by December 2025. Also in this year's throne speech, the Ministry of Health will continue to build on the commitment made in the mid-year budget review to expand and enhance mental health initiatives. Our goal is to create a Bermuda where mental health is understood and supported without stigma. Key initiatives include launching a mental health awareness campaign to educate the public and encourage help-seeking behaviors, implementing a suicide prevention strategy, establishing a community outreach program for tailored support, starting a national health advocacy program with conferences, school programs, and training, supporting the MH-GAP program to integrate mental health services into primary care, piloting a school-based health behavior intervention program, hosting a youth mental health summit, providing grants to support mental health organizations, and creating an emergency fund for complex mental health and social care cases. By building on existing programs, supporting existing third sector agencies, and focusing on youth mental health, a more inclusive and supportive environment will emerge for mental health well-being within our community. As you would have seen in the 2024 throne speech, we did not forget our seniors. We understand that being on a fixed income can be incredibly challenging, and with the rising cost of living, it's even more difficult to manage expenses. When it comes to health care, we know that these financial constraints can lead to delays or even a lack of necessary care, and your health is our priority. And we are committed to finding solutions that ensure that you receive the care that you deserve without added financial stress. As we eagerly await the rollout of our new Universal Health Plan, the government is committed to expanding access and enhancing the quality of HIP and future care clients. This means that you can look forward to more comprehensive preventative visits to your doctor, prescription drug coverage, and reduced copays. These changes, set to be introduced during this session, aim to reduce out-of-pocket expenses, ensuring that you can afford annual checkups and the medications prescribed by your physician. This is all part of our commitment to making healthcare more accessible and affordable for everyone. You can expect the release of specific information on what this various benefit enhancements and extensions will look like to HIP and future care participants in the short term as we work towards increased access and affordability to health care and a better quality of life. And lastly, while the journey towards universal health care has not happened as quickly as we would have preferred due to the impact of the coronavirus pandemic, the government remains fully committed to its mission to ensuring that all Bermudians have access to quality, affordable health care. In the year ahead, the UHC program will pursue some very important goals. To start, in collaboration with our healthcare stakeholders, we will determine the healthcare services to be included in the core benefits packages for all. And this is the package of healthcare services that all residents will be able to access. We will also determine how much the services will cost, and we will explore various ways to make these vital healthcare services available to everyone in a sustainable way, while also evaluating how our options will impact the economy. As I conclude my remarks today, I want to emphasize the urgent need to strengthen Bermuda's healthcare system. We must improve health outcomes, increase efficiency, and ensure quality, affordable health care is available to all. The high costs of our current system are not reflected in our health care outcomes, and this must change. Aligned with the theme of this year's throne speech, A Fairer Bermuda for All, we are launching crucial initiatives that will help to foster a more equitable society. Our efforts include to eliminate trans fats, enhance mental health initiatives, and advance HIP and future care, as well as universal health care. The upcoming legislative session will be a significant step forward in our mission to enhance health outcomes. We want to build a healthy Bermuda and a healthy community for all, ensuring that every Bermudian can thrive. And I will answer a couple questions. I will answer some questions, and then following that, I'd invite the Honorable Minister Weeks of National Security to come and take the podium.
Thank you, Minister. We'll start with Bermuda Broadcasting.
Thank you, Minister Wilson. My first question is on trans fats. I wondered if you could elaborate further how trans fats will be eliminated from the island's food supply. Do you envision this being a phased approach?
Thank you for that question. We will, similar to other jurisdictions that have already gone before us in the elimination of trans fats, we are working with PAHO and the United Kingdom Security Agency to set up the proper laboratory equipment that we'll need in Bermuda so that we can test various restaurants, et cetera, with respect to trans fats. This is a moving target, and all of the other nations have already been implementing this, and we are trying to be consistent with our CARICOM neighbors to have it completely removed by 2025, and we think that we'll be able to accomplish that.
Okay. And do you anticipate this policy complementing the sugar tax initiative that's already in place?
There's two issues as it relates to that. The sugar tax initiatives, as you can appreciate, when we first introduced that, was to reduce our sugar consumption. We've found that, unfortunately, we have high instances of diabetes and other chronic non-communicable diseases that are largely impacted by what we eat, such as sugar. We recognize that the issue of the sugar tax has caused some disquiet in the community. However, the most recent omnibus survey showed that more and more Bermudians are reducing their sugar intake, as well as accepting the fact that the sugar tax is something that can be commended to ensure and enhance their health. On the other hand, with respect to the trans fat, we are removing that from our diet because we recognize that, regrettably, it is causing higher instances in chronic diseases such as heart attack and the like, and there's absolutely no health benefits to trans fat. It's just something to help extend the shelf life. So both of those in conjunction will assist us with respect to meeting our health outcomes.
Okay. And lastly, does your ministry have any data yet on how the sugar tax has been working? How many revenues have been generated from it?
I don't have that information with respect to the revenue, but like I said, there was a recent omnibus survey that indicated that there was, and I can give you the statistics, that there was a higher percentage of individuals, approximately 2 in 10 residents are no longer buying sweets, snacks, or treats, and that 7% have stopped buying junk food altogether. So again, we recognize that it is a slow progress, but when you implement these type of initiatives, you don't see a change overnight. But in a generation, we will see a reduction in the consumption of sugar for the benefit of all, particularly because of our high instances of chronic non-communicable diseases, such as diabetes.
Thank you.
Thank you.
Thank you. We'll now take questions from the Royal Gazette.
Afternoon, Minister.
Hi, good afternoon.
On the issue of trans fats, are you concerned that foods that don't contain this and foods that aren't highly processed are going to be far more expensive than those that do? And is this going to cause food prices to soar?
I don't think we have that as a concern. A number of restaurants have already started recognizing the health benefits, reducing trans fats from their offerings. There are other types of oils that are more beneficial and that have, a higher percentage of positive impacts with respect to health. So I don't anticipate that will cause any challenges because many restaurants on their own are taking the initiative to remove trans fats from their supply.
Okay. Mm-hmm. And just one other question on universal healthcare.
Yes.
From the sound of it, it's not going to be introduced in the next parliamentary year, is it? Do you have a timeline of when it might be introduced?
Yes. You may recall that we've spoken about the Bermuda Health Strategy 2227, which listed 8 principles that are all designed collectively to strengthen our health system, one of which was the introduction of universal health coverage. The other things were such things as introduction of a national digital health strategy, recognizing our population needs and the joint strategic needs assessment and the like, and all that information can be found online. However, in order to advance universal health coverage, we need to know our starting points, know where the data is, we need to cost it out. We are working with our stakeholders now so that we can identify what will be in that core benefits package that will provide the universal health coverage. So we will continue to move that forward. There will be legislation as well, but it is anticipated that we will have a full rollout by 2026.
Okay, super. Thanks so much, Minister.
Thank you.
Thank you. Thank you, Minister.
Okay, thank you.
Good afternoon, everyone. I'm happy to share with you the Ministry of National Security's initiatives highlighted in the 2024 Speech from the Throne. Firstly, I am pleased to announce that on Friday, I will be tabling the National Violence Reduction Strategy in the House of Assembly. This comprehensive plan is the result of extensive efforts and collaboration among various stakeholders over the past months. Recognizing the multifaceted nature of violence affecting Bermuda, whether physical aggression, psychological abuse, or antisocial behavior, we understand that a one-size-fits-all solution would not suffice. To address this, we convened a 2-day consultative workshop that brought together representatives from government agencies, private sectors, faith-based organizations, sports clubs, and community organizations. Their invaluable insights have helped to shape our strategy focused on prevention, intervention, and integration. Our mission is clear: to implement strategies that will reduce violence in Bermuda, particularly gang violence, through collaborative efforts. This National Violence Reduction Strategy is more than a policy document. It is a commitment to create a safer Bermuda for all. It emphasizes identifying root causes, promoting educational awareness, and strengthening both institutions and individuals. We aim to protect the most vulnerable and ensure accountability for those who perpetrate violence. Importantly, the strategy focuses on redemption over punishment, offering pathways for individuals to reintegrate into society without stigma. This includes support for relocation and opportunities for those seeking different social and economic environments. A key component of this strategy is our youth. We believe that by steering young people away from destructive behavior and harmful mindsets, we aim to prevent the cycle of violence from continuing into future generations. We are leveraging established programs and interventions tailored specifically to Bermuda's needs, promoting inclusion rather than exclusion. Our approach involves collaboration between perpetrators and victims, fostering a community-wide commitment to peace and mutual respect. We stand at a pivotal moment where collective action is essential. This strategy is a call to all sectors of our society to stand together against violence in all its forms and work towards a future where peace and respect are the norms. By uniting our efforts, we can restore the sense of safety and community that previous generations cherished and that what we aspire to provide for in the future. In addition to the violence reduction strategy, I'm excited to announce the reinstitution of the Bermuda Youth Counseling Services under the Department for National Drug Control. Originally launched in 2002 as a standalone unit, this service provided vital outpatient counseling and case management to young people, ages 10 to 18, who were at risk of drug and alcohol abuse. Over time, the program evolved and was integrated into other services, but we have recognized the pressing need to reestablish it as a dedicated resource. By reviving the Bermuda Youth Counseling Services, we aim to address current gaps in substance abuse treatment and counseling for adolescents. Utilizing age-appropriate interventions and treatments, we will provide targeted support to help our young people overcome challenges related to substance misuse. This initiative reflects our ongoing commitment to supporting families and individuals in need, ensuring that they have access to the resources necessary for healing and growth. Lastly, I want to emphasize that our legislative initiatives outlined in the throne speech will go hand in hand with the initiatives to be outlined under the mid-year budget review. One of our priorities, made possible by the additional funding, is the empowerment of our youth with the expansion of the Ministries' support for sporting and community clubs across our country, recognizing the critical role they play in fostering teamwork, discipline, and healthy lifestyles. By assisting where possible, the aim is to help these clubs and their youth programs to create even more avenues for young people to get involved in constructive, community-focused activities. For young people who may be struggling, including those involved in the Gang Violence Reduction Task Force outreach program, we are dedicated to providing opportunities for them to advance their education and develop vocational skills. For participants nearing the end of high school, we will offer assistance to help them obtain their GEDs in the coming academic year. Those who meet the entrance requirements for Bermuda College will receive financial support to cover tuition, fees, books, and materials. We are also expanding training options to include apprenticeships, local certifications, and opportunities for overseas training. In addition, we are expanding the community counseling program to offer more personalized support to those impacted by violence and trauma. Recognizing the profound effects on families, children, and victims, this program provides access to trained grief and trauma counselors for a series of individual and group sessions. Addressing the emotional and psychological needs of those affected is crucial for promoting genuine healing and recovery within our communities. So before I hand over to my colleague, Minister Jason Hayward, the Minister of Economy and Labor, I would take any questions.
Thank you, Minister. We'll start with the Royal Gazette.
Minister, good afternoon. Just a couple of things. You talked about this legislation that you're going to be tabling in the House on Friday concerning the National Violence Reduction Strategy. And you talk about this will enable a more collaborative approach between all the various agencies. But shouldn't we be having that already? You know, isn't there liaison between, you know, the courts and the police and social workers? And we seem to have so many sort of groups such as, you know, the Gang Violence Reduction Task Force. We have all these groups, and surely they should be working together already. Are they not?
Well, actually they are, and this strategy is actually a combination of all those groups that you have just mentioned. This anti-violence gang strategy is a result of all these groups getting together, government agencies and private organizations coming together during our two-day workshop, and out of that workshop has come this anti-violence gang strategy.
Okay. You mentioned words like redemption and reducing the stigma of gang violence. That all sounds a bit kumbaya-ish, don't you think? Shouldn't we be getting tough on gangs? You know, we've had this issue for, what, 20 years now, and nothing seems to work. It's getting worse, if anything. And now you talk about, you know, reducing the stigma of being involved in gangs.
Well, I have to disagree.
How about increasing the punishment for those who are involved in gangs?
Okay, but I think I disagree with you that we are getting worse. You know, we have a society that is right in the midst of gang violence and other anti-violent behavior, and we have been working at it diligently to curb that. And a part of curbing it, because of our society, is to try to help those that have found themselves on the wrong side of justice and engage in anti-violent behavior to be reintegrated back into our society.
But don't you think you should be focusing more on things like increasing the manpower of the police service?
Yes, as a matter of fact, this year, in the regular course of our recruitment, we have just hired 25 new police officers, which will start in November, in this month.
Okay.
In the mid-year report, when the Premier gave us $2.2 million extra for the police service, that was a way of the Finance Minister putting money where our mouth is. Right? And we are now advertising for 25 more officers. So in February, we intend to have 25 more officers joining the police service.
Okay. You mentioned substance abuse amongst the youth and trying to educate them to sort of stay away from drugs and what have you. But don't you think decriminalising cannabis hasn't helped? Wouldn't it be better to actually make it illegal?
Well, I'll tell you what, decriminalizing cannabis is not just the drug itself. There are a lot of different things that are helpful and medicinal properties that come with decriminalizing cannabis. So I think that alone is not the issue that we have facing our youth.
Okay. And one final question. It's not strictly related to the throne speech, but any update on CCTV?
CCTV is ongoing. We are upwards of 80% complete. We've had a few hiccups with having to order more pearls and whatnot. They are now on island, and Belco is diligently putting them into the ground. So we are very close to realizing the goal of phase 1 and finishing putting up CCTV.
Any set timeline, deadline? Are we talking another couple of months or?
Well, I don't want to say a timeline. If it's up to me, I wish it could be done tomorrow.
Sure.
But we are upwards of 80%. So
Okay.
having said that, I think we are very near completion of phase 1 of CCTV.
Super. Thank you, Minister.
Thank you.
Thank you, Gareth. We'll invite BBC.
Thank you, Minister. I don't think I have many further questions for you, but I just wanted to clarify the National Violence Reduction Strategy. So you're saying that it's going to involve a combination of groups getting together for one, core cause. Why couldn't that have been done before the strategy? Why did you need to kind of brand this new strategy and take it to Parliament?
Well, actually, I had told Parliament a few years ago, about 18 months ago, that I will be having a workshop to bring together all the relevant organizations, government organizations and private entities, so that we could collaborate and we could find what gaps we have in supplying help to our people that's engaged in anti-violent behavior, and see where we are duplicating services. So that was the point of the two-day workshop. And out of that workshop has come the national strategy to combat anti-violence.
Okay, so the strategy will essentially streamline government's response to violence?
Most definitely.
Okay.
Yes.
And then the Gang Violence Reduction Task Force is not going anywhere. That will stay.
Well, the Gang Violence Reduction Task Force has played a major role in assisting in getting that strategy together. So they will still be a major part of the anti-violence gang strategy.
Okay, thank you.
Thank you.
Minister, just one more question from the
Yes.
Gazette.
Thank you, Minister. Yeah, sorry, one other thing. The throne speech stated, regrettably, 18 years after the Police and Criminal Evidence Act 2006 was enacted, the fulsome nature of its intended protections for those who encounter the vast powers of the prosecutorial apparatus are not yet in force. Therefore, the remaining provisions of PACE, which deal with custody time limits and the detention of arrested persons, will be brought into force during this session. So could you just say what specifically are the provisions and why is it taking so long for them to be enforced?
Can you clarify that, because I think you lost me?
The remaining PACE regulations that haven't been implemented yet.
I cannot answer that at this point in time.
Yeah.
No.
It's said in the throne speech, I'm quoting from the throne speech, remaining provisions of PACE which deal with custody time limits and the detention of arrested persons will be brought into force.
Well, it will be brought into force in due course. So hopefully in our next year, we'll see those initiatives realized.
Okay, thank you, Minister.
Thank you.
Thank you, Minister.
Thank you. Ms. Hayward.
A pleasant good afternoon to members of the media and the listening public. Following the speech from the throne, the Ministry of Economy and Labor remains committed to the plans and initiatives outlined in the speech as we continue to create a fair Bermuda for all. I am happy to share the Ministry's priorities over the upcoming parliamentary session. Bermuda's workforce have proved to be the solid foundation on which economic progress is made. The government has taken several steps to improve labor conditions, including advancing the minimum hourly wage, strengthening the Employment and Labor Relations Tribunal awards, retaining older workers, and investing in workforce development. During this session, the minimum wage will be further strengthened. In September of this year, the Ministry of Economy and Labor released a position paper titled Progressing Bermuda's Minimum Hourly Wage Rate. The purpose of that paper was to outline government's commitment to progressing the minimum hourly wage rate beyond the current $16.40. and the proposed framework to achieve this. The establishment of a minimum hourly wage in Bermuda was a significant step forward. It was a step towards ensuring fair compensation for employees and reducing income inequalities. However, a further step is needed to be taken to ensure all employees can maintain a reasonable standard of living, that their purchasing power is not diminished when the cost of everyday goods and services rise. The government supports the position paper proposals to progress the statutory minimum hourly wage rate every 2 years by the annual average inflation rate, utilizing the Consumer Price Index as an indicative measure capped at 2.5% per year. Using this methodology, the newly proposed statutory minimum hourly wage rate to take effect in 2025 will be between $16.81 and $17.23. The Department of Labor and the Employment and Labor Relations Tribunal continue to experience non-compliance by some employers who reject their legal obligation to honor the tribunal's binding awards of compensation to employees. In many instances, the employer will not reinstate or re-engage the former employee, and also will fail to honor the award or make arrangements to pay the worker. In this legislative session, the Ministry of Economy and Labor and the Department of Labor will enhance greater protections for workers in enforcing tribunal awards. In alignment with the position paper on retaining the local workforce and to encourage the retention of those Bermudians over the age of 65 who wish to continue working, the Ministry of Economy and Labor will introduce legislation to eliminate the employer's portion of payroll tax for those Bermudian employees who are so retained. In 2018, the Labor Advisory Committee produced a report entitled Reviewing the Retirement Age. The report concluded that older workers should, without discrimination by reason of their age, enjoy equal opportunity and treatment with other workers as regarding recruitment, hiring, compensation, benefits, training, working conditions, and career development. The Ministry of Economy and Labor is committed to providing benefits to businesses that retain able-bodied, capable workers beyond the age of 65. These changes will aim to retain the current workforce, while other efforts will focus on growing the island's economy, creating more jobs that support the increased working population. As baby boomers reach retirement age, many remain capable and able to carry their duties out with competence. The Department of Workforce Development will continue to be the principal vehicle for equipping Bermudians with the skills and opportunities to thrive in this growing economy. The development of skills trades is essential for the economy's growth, sustainability, innovation, and success. Skills trades offer a viable career for many individuals interested in pursuing a career in a hands-on, practical field. These careers can provide steady income, job security, and opportunity for growth and advancement. During this session, the Ministry of Economy and Labor will expand apprenticeship opportunities in construction and skills trades, expand solar energy training for electricians, accelerate hospitality training to meet the growing demand of the industry, and launch a new career development platform to close the workforce gap by developing students and job seekers and directly connecting them with jobs. To assist long-serving employees facing unexpected unemployment and loss of income, the Employment Act 2000 will be amended to increase the maximum allowable salvage pay from 26 weeks to 32 weeks for those employees in continuous employment for 13 years or more. This increase will be accompanied by a legislative amendment to remove the requirement to pay payroll tax on redundancy. This will help provide stability and fairness for employees during times of transition. This government is committed to taking measurable steps in supporting our workforce and is clearly demonstrating with these initiatives. Continued economic growth and stability requires ongoing engagement and undertakings of this nature. The government and the Ministry of Economy and Labor remain committed to supporting our workers and creating a fair Bermuda for all. Thank you.
Thank you, Minister Hayward. At this time, we welcome questions from the media, starting with Alyssa Bernardo from BBC.
Good afternoon, Minister.
Good afternoon.
My first question is, one of your policies touches on retaining older workers. Are you aware of how many people in Bermuda are working past their retirement age?
Most definitely we have the statistics. I don't have the statistics offhand, but I can provide you with those numbers. On an annual basis, we provide the labor force statistics, and they will be found in that particular brief. And you can see actually the workers by various age categories. What I would say is that the number of persons over the age of 65 is actually expanding.
Okay. And do you think that's indicative of people trying to manage, the challenge of rising costs, living costs, or is it the fact that people are just living longer and healthier?
It could be a combination of multiple factors. And so, one, when we done the report retaining about whether or not we increase the retirement age, there was certainly a desire for persons to work longer for a number of reasons. Not all were financial. Some was to do with just the person that has continued competency and capability to continue in the workforce. The cost of living has been a challenge and will remain a challenge, and we recognize that not all pensions provide adequate income after retirement, and as a result, that could also be a driver as well.
Okay, thank you. And my last question touches on the minimum hourly wage, which is expected to increase in 2025. What is your assessment of that wage? Do you think it's livable and fair?
We think that it is a decent wage based off of the work that was done. We are going to do additional work regarding a livable wage. A livable wage and a minimum wage are two separate concepts. The minimum wage is never meant to substitute what a living wage will provide individuals. But a minimum wage is a statutory minimum in which employers can pay employees under. Prior to us implementing this minimum wage of $16.40, there was no floor as to the level of remuneration and compensation that employees can receive. And so this is a fundamental step in the right direction. Bermuda's minimum wage rate remains one of the highest minimum wage rates in the world, and we will continue to progress that minimum wage rate.
Okay. And do you foresee your ministry proposing a livable wage in the future?
Most definitely. The Wage Commission is currently working on a livable wage, and we are currently working with the Wage Commission to identify the most appropriate methodology moving forward. The Household Income and Expenditure Survey that is being conducted by the Department of Statistics will give us sound data as to persons' income and expenditure patterns and on what items that persons are actually expending their income on. That will give us enough benchmark data so that we can, with a level of confidence and accuracy, produce a living wage rate.
Okay. Thank you, Minister.
Now, welcome Gareth Finnegan from the Royal Gazette.
Afternoon, Minister. Just one question. Is there anything in the throne speech, anything concrete in the throne speech that is addressing the need to increase the working population by, I think the figure was 8,000, was it, over the next couple of years? What steps are being taken to tackle that issue?
And so you know that we developed the Economic Development Strategy, which was ultimately designed to create robust economic activity across multiple industrial areas, which will actually create more jobs, and then we can fill those jobs with able-bodied individuals. And so if you ask me whether or not concrete steps are being taken to increase our working population, I'll say yes. What we currently do, we currently support the industries that we have in Bermuda for expansion. We're trying to attract new businesses in Bermuda. You would have witnessed the groundbreaking at Fairmont Southampton Princess. That will create additional jobs for the economy, and not just within that particular facility, but as a multiplier effect for other and additional economic activity to expand within our economy. You will look at our job numbers last year, and we increased jobs by roughly around 1,000 new jobs in our economy. And so we are making steady progress in the right direction, and we will continue to make that progress. But the economic development strategy is the primary tool which would drive economic growth and development, which will create jobs.
Okay, thank you, Minister.
Thank you, Minister. That concludes the press conference. I'd like to thank everyone for joining us today, and have a great day.